COVID-19 cases are ramping up again here in California with some infection rates on the level of the winter surge. Fox 40's Karma Dickerson joining us now live at the Capitol with what we know about the variants driving these new infections. Karma.
Well, Nikki, at this point, we can tell you these variants come with good and bad news. And what health officials want you to know is if you think you have some immunity, think again. COVID-19 is making another comeback with the help of two new Omicron variants, BA4 and BA5. California's test positivity rate 10 times as high as it was in April, growing from 1.5 to 15%. The most notable thing about the variants, according to experts,
they're able to evade previous immunity.
So vaccinated people are at risk of infection, as are people who recently had COVID.
The wall of immunity that we thought we built up with the large Omicron wave in January has essentially crumbled because the virus has mutated.
More than half of California counties, the ones you see here in orange, meet the CDC definition of high COVID-19 community levels. Yellow is medium, and just 3 are low, shown in green. The good news is infections from the new variants are mostly mild, according to health experts, especially for people who are vaccinated. Still, infectious disease specialist Dr. Dean Blumberg with UC Davis says repeatedly contracting COVID can take its toll.
There's emerging research that suggests with each repeat infection, there are complications, other complications that may occur, such as strokes, heart attacks, and other long-term complications. And so it is still good to try to avoid those infections.
In Yolo County, where case rates are tied with Solano for 5th highest in the state, health officer Dr. Amy Sisson says BA4 and 5 variants account for more than 50% of coronavirus cases. Wastewater levels show COVID community levels as high as they were during the winter surge. Still, hospitalization numbers remain relatively low. Dr. Sisson believes that's due in part to available treatment.
If you're 50 and older or you have an underlying condition that puts you at high risk of severe disease, then strongly recommend you talk to your doctor.
As for what's to come, how long do we have to keep being hypervigilant?
I think it's hard to predict. I think within a year or two is what I would expect is we're going to be in that place.
They said a year or two before things normalize and before you can expect to maybe be able to treat this more seasonally, for example, like the flu. That was one prediction that we heard today. In terms of what we should do with this information that we have, it's more of the same. They still recommend getting vaccinated, saying even if it doesn't stop you from getting infected, it will protect you against severe disease. Reporting from the Capitol, Karma Dickerson, Fox 40 News.